A more contagious strain of the coronavirus is now in Indiana. That is the official word tonight. This is the strain that was first found in the United Kingdom, and it led to a national lockdown there.
Fox 59's Courtney Crown spoke with local health experts about what the discovery of the strain means for all of us.
The fact that it was in Indiana is really more of a confirmation of what I think most people suspected anyway.
Experts say no evidence suggests this strain, initially found in the United Kingdom, is more lethal nor causes more severe infections. But it's about 50% more infectious than the original version. Instead of one person infecting 2 people, those with the new strain are infecting 3 if no precautions are taken.
Those 3 go to 9, those 9 go to 27, and those 27 go to 81.
Do you think that we're going to need to change any habits that we already have in place to deal with this new strain?
There's really nothing that we need to do differently to protect ourselves from the new strain because it's transmitted in the same way.
I think if we try to add new behaviors, we'll just have people who do the old behaviors less well.
And as of now, experts are confident the vaccines will protect against this strain too. But unfortunately, they tell us there are bottlenecks in administering the shots.
We have small health departments all across Indiana that are really struggling to do the vaccines and get people through the pipeline as quickly as possible. We also have just a limited number of people, healthcare workers, that are authorized to give vaccines. Given our situation, I know we're doing the best we can.
It's still affected by mask wearing and social distancing and hand washing.
Courtney Crown, Fox 59 News.
IU Health's Dr. Paul Calkins says people do not need to panic, and as well that he is concerned though that the fatigue over basic health precautions could cause some issues in our communities. Again, doctors underscore these play a really large role in preventing further spread. State Health Commissioner Dr. Christina Bach says now more than ever we have to wear masks, we have to social distance, and we do need to maintain good hygiene.